Welcome to RHI Sociable City Interviews, where we meet with global thought leaders on nightlife and the social economy. Today, I want to welcome Robert Saltz, Senior Research Scientist with the Prevention Research Center at the Pacific Institute for Research and Evaluation.
Well, I'm here today with Bob Saltz, who's a senior scientist with the Prevention Research Center. And it's one of a few centers in the world that focus in primarily on prevention. And particularly, Bob's expertise is around alcohol, and most particularly relative to the venues that serve and sell alcohol to the public, as well as also looking at college campuses and college lifestyles as another element of his monumental work that he's done over the years. So, Bob, it was great to talk with you when we were in Seattle. It was a day before we all got onto planes, only to return to what has become essentially a shutdown in nightlife and a reorientation of how people are socializing with a lot more home parties. And we've also seen, changes in alcohol policy that some would have never anticipated or thought should happen. But in reality, in some cases, the sky didn't fall because they made a little policy change of letting restaurants let people take mixed drinks home, or, allowing for public consumption in the public space. And these are some of the policy changes. But also you're seeing a focus on closing times, with curfews. And those also have always been in the news about what was problematic in some cases before was that common closing time. So I'm really here just to gather your insights into how, from a prevention perspective or within the world of alcohol researchers, what are people talking about? What do they see as happening now? But more importantly, what could happen in terms of cities and states working to learn from these experiences and maybe put in place certain things that they hadn't thought possible before?
So, as a researcher, one of the first questions I and my colleagues have is, what happened to alcohol consumption in the immediate onset of the pandemic? And it looks like there was, in fact, a spike in March, maybe early April, in purchasing alcohol for home. And the concern we all had is that alcohol consumption, including the riskiest heavy consumption, is shaped by the easy availability of alcohol. So if people are stocking more than an usual amount at home, we could expect an increase in consumption across the board. But it does look as though after that first initial almost panic buying, hoarding of alcohol, overall sales of alcohol decreased by about the same amount over as we moved into May and June. So we saw a spike, and it seemed to have dissipated a bit, and then we're not so much concerned at this point, and we have to keep monitoring it, but we're not so much concerned at this point for a massive wave of extreme consumption of alcohol. But there's still something that we're concerned about. There's still the problem, I would say there's sort of narrow and the broad program. The narrow program is the fact that alcohol regulation has kind of been thrown out the window in a wild west of not just that regulations have been eased or eliminated that we had before, but that it changes so often and by location and by weeks or days of the week even, so that nobody could be really sure what regulations are in force. And the public needs to know what the rules are, if there are any, and can anticipate them so we don't see weird behavior like rushing to a nearby county where the restrictions are less severe than the one you live in. So I'm disappointed that that we didn't do this more systematically, but that disappointment is shaped by the fact that almost immediately people seem to regard alcohol consumption as an essential behavior, so to speak. and that it seemed to reinforce the notion that above all else, people should have easy access to alcohol at all times and in places. I realized some of this was shaped by the desire to try to maintain our restaurants and bars during the pandemic when they couldn't provide the usual service they did, indoor dining and service. So there's that, it remains to be seen how much the collapse of these alcohol regulations might contribute to a long-term sense that we should just lay off of alcohol, regulations of all kinds. So there's that kind of concern, reinforcing the definition of alcohol as somehow central to everyone's lives, and also a relaxation of those regulations. So that gives rise to the fear that it'll be difficult to return to even the regulations we once had. And again, something maybe one of your scenarios you might plan for, or someone might plan for, is will we be able to return back to the state of things in 2019, or will that change, or will it even get better? So I think there is reason to find something of value in the experience of 2020. One of them is that I think there's a greater appreciation for what bars and restaurants provide other than the alcohol itself. People obviously want to return to these places they've enjoyed. They return for the human and social interaction, not just because there was alcohol available. And I think that's something that could be widely understood now, and maybe not so well understood a year or two ago. And so it opens the possibility that people will understand why we have restrictions on sales of alcohol, and that those may not necessarily they may not injure our ability to have the social interaction and the hospitality that we want in our bars and restaurants. So that's a good thing, I think, to separate the alcohol from the hospitality.
So it's kind of a realization, as we say, that alcohol is a lubricant of sociability, but it's not necessarily necessary for sociability or the focus.
Sure.
Of it. Yeah.
And this is something, and you mentioned my work as college students. This is something I always wish I could. It's a little too nuanced for most college and university prevention programs, but to get students to understand that the excessive consumption isn't necessary for what they want in their parties. It's a tough sell, and it's also one that I think people they have sort of given up on. But let me get back to the last thing I guess I want to make about. I think not just on matters related to alcohol, but generally, especially with social distancing and mask wearing, I think this experience has given us a greater appreciation of how public health regulations or restrictions are not just about your own personal annoyance, where we can see how slight sacrifice at the individual level can result in a much greater good for the general population. So if we have, say, refusal of sales to obviously intoxicated patrons, yes, it's an annoyance for that person who might have wanted to have several more drinks, or they thought this was going to ruin their evening in some way. But in fact, I think we all have a better understanding now about how complying with those restrictions can spread much better safety and health to the larger population. At least I'm hoping that's part of what we've learned from the need for these kind of public health approaches to dangerous and risky behavior.
One of the important, I think, transitions has been a real focus on the health department, which tends to, in many situations, operate at the county level.
Mm-hmm.
Obviously, smaller states, it's a state health department. But in larger states, you have the county, and the county health department has been the ones that have been dictating hours of operation, seating capacity, outdoor dining, all those restrictions. And up until now, it has always been the state alcohol regulating authorities that have defined some of the standards of operating. And now they're almost taking a second seat or a third seat, because now you have the fire department also coming in relative to occupancy and enforcement. And, while in some jurisdictions it's the alcohol regulators that are enforcing the public health occupancy standards, it's still being defined and dictated. Do you think that that kind of transition to a county level may ultimately become more significant as it relates to how businesses are authorized to open and operate? Or do you think the state alcohol authorities will still maintain kind of the dominant role?
Well, there's a couple of things there. As you were beginning to talk about county health officials, I was thinking immediately of the fire department. It's always been there with its focus on the safety aspects and overcrowding and all the rest. So we hadn't thought about the fire department as dictating something particularly, but they're there to reinforce the restrictions that are there for public safety. The same is true of the public health officials. Their role is paramount now because of the pandemic, and it could come back again in future epidemics. But they're going to step away from this. And I think this is kind of another thing I could have brought up about the silver lining in all this, is understanding that those public health restrictions are there and they can be imposed, yes, but they can also be pulled back when deemed safe. So it reinforces the notion that there's a rationale for these restrictions, whatever those are, because they come and go means that it's not just somebody who says, well, I don't like the idea of alcohol being sold in on-premise establishments, but rather we're facing a dangerous situation and we need to put in some restrictions. And when that situation is changed, if we, in this case, we get the vaccine and we see there's widespread immunity, then those restrictions can be relaxed. And so there is a rationale behind them and not just somebody trying to spoil your fun, so to speak.
In conclusion, I'd like to have you kind of summarize in a 90-second soundbite here how the future of the prevention world could kind of coexist with those that are involved in planning and regulating and really have a seat at the table, which we're going to do in March, where you'll have a seat at the table with all these other kind of stakeholders in trying to mark out the position of the prevention field, and particularly as it relates to what we refer to as responsible beverage service training and policy. So can you kind of summarize in a minute and a half where the prevention field is going to fit in the future, and what kind of seat should they have going forward in the reigniting of the social economy, particularly for the larger occupancy venues that cater to the younger adults?
Okay, I'll try. What I think the prevention field wants is a recognition of the dangers, the risk that's inherent in these venues or in these neighborhoods that have a cluster of such venues, or in the case of college students, college student parties. The recognition that there's a risk there is the first order of business. And the second one then is to understand what options there are to reduce that risk. And sometimes some of our more effective interventions, like enforcing laws against sales to intoxicated customers, are not applied because people either think it's too difficult or that it's too intrusive. And we have to kind of, as a prevention specialist, we have to get past those objections to effective interventions in order to make a venue or a neighborhood safe enough so that we feel we've discharged our responsibility to save lives. And I guess there, we can get into details, but that's for another discussion.
Okay, well, this has been very informative, Bob, and I appreciate you taking the time. I know you're a busy person, and it's always a pleasure to work with you.